Welcome to Fun with ECGs. "30 seconds to look for evidence of ischemia." So the rate is 72. We have sinus rhythm, normal axis, normal Q restoration. Look at the anterior leads. We have some ST elevation extending from V1 to V5 for a maximum of about 4 millimeters. But importantly, we don't have any reciprocal changes in the limb leads, and the first deflection of the QRS in V1 to V4 is negative. There's no R wave there, so these are Q waves, deep Q waves in the anterior leads. Technically speaking, there's a tiny little R wave here, therefore this can't be called a Q wave, but there's this almost complete loss of the R wave in V5 shows a lot of damage has happened even around as far as this territory. Also note that the baseline is moving. This is an extensive old anterior myocardial infarction. The age of it's uncertain, and it may well reflect an LV aneurysm formation. This might be the patient's ECG the day after their infarct. It might be these ST segments would still resolve. It might be some R wave will recover, but it's also quite likely this patient is years on from their infarct. So we need to carefully assess their symptoms. This could be a patient with a previous infarct who's got new ischemia, but very hard to interpret. You need serial ECGs to see the dynamic changes. It could be that they've had an infarct a week ago. You need to carefully consider that with their symptoms, but they're unlikely to benefit from acute intervention because it's likely most of the damage has already happened, although if they're still in ischemic sounding pain, it would need careful consideration, so you need an expert assessment. This is an example of an LV aneurysm on a chest x-ray, and this case is quite unusual because it's calcified all around, so you can see the boot-shaped heart, the left ventricle which is bulging outwards like a boot, and the area is heavily calcified. This patient also has a left ventricular lead here and two ICD leads, one of which has obviously failed. We can imagine the patient is in atrial fibrillation because they don't have an atrial lead, so you'll immediately realize this isn't the X-ray of this patient's ECG. Thanks for watching.